Hi everybody, Dr. Anjana Bania here and welcome back to my YouTube channel. Today, as you can see from my top, we are going to be talking about hyperpigmentation. So hyperpigmentation, I've done a couple of videos about it before, but it's a huge topic. It affects a lot of people around the world, across ethnicities and skin color. And it's something that people struggle with, men and women, every single day. And one of the most difficult ones to treat would be a chronic type of hyperpigmentation that's in your epidermis and your dermis called melasma, and in pregnancy, chloasma. And I was chatting to my husband one of the days and I was telling him about how difficult it is to treat this chronic type of hyperpigmentation because it's a forever maintenance. So you have to be, it's chronic, so you have to be treating it in a way or maintaining it almost forever. So I likened it to fitness, and I said, you know, treating melasma is like trying to get and maintain a six-pack of abs in the gym. You know, a lot goes into it. There's your diet, there's the daily exercise, there's core exercises, there's supplements, and the same with treating hyperpigmentation. So one of the treatments that's one of the gold standard treatments for melasma, and it also is really good for solar lentigis, for freckles, as well as post-inflammatory hyperpigmentation, is something called the Cosmelan Peel. But it's not just a peel. I'll tell you a little bit more about it. We tell our patients that it is a program. So before embarking on this program, we have to prepare your skin. So prepping your skin involves getting the barrier repaired with things like niacinamide and barrier creams, good sunscreen, so reducing the amount of melanin produced and getting you into the good habits of reducing the sunscreen, and like lifestyle things, like, you know, if you're an outdoorsy person or you like running or exercise, keeping cool while you're doing that, not very hot showers. So almost training you between 4 and 8 weeks, prepping your skin down, regulating the cell called the melanocyte. It looks like I'm doing this because it looks something like this. It's got these dendrites that shoot out these little balls of pigmentation. So your skin has to be prepped. I think with a lot of patients, where the failure comes in is inadequate prep. So we have to remember that this is not a quick fix. And when we like, you know, counsel patients before this treatment, we call it a walk through fire. So it's a treatment where there's a lot of, as we call it, hand holding, you know, daily contact with the patients, lots of physical check-ins as well. So once your prep is done and you're prepped with skin brightening products, good sunscreen, barrier repair, you come in for the peel. And it's a mask peel that goes into your hairline and spreads. It doesn't really go down to your neck, and you keep it on for 10 hours, keeping it moist throughout that time, and then washing it off. Then after washing it off, you're a bit swollen, you're red, you're sensitive, and there's a barrier cream. There's one in here. It's called Melan Recovery. It has Sika in it. There's a whole lot of things in it. One of the things is also niacinamide for barrier repair. That is applied along with a special sunscreen, 130 Protect. So you are using this for a week, and then you get something called Cosmelan 2, which is a tub of a weak version of the peel, and that is also applied then 3 or 2 times a day depending. And then I always tell patients, you know what, you look horrendous for 2 weeks. You're dry, you're cracked, you don't feel very great, and the treatment, the results come really, really quickly. So by the end of the month, after the peel, after going through this walk of fire where you're peeling, you dry, and you moisturize a lot, you have this amazing result. But that is not there, and that is just all the pigmentation that was already present in your skin is gone. So you know, a lot of people think it, you know, you probably get a lot of questions from your family. Are you bleaching your skin? What are you doing? Because you look very, very hydrated, but also bleached almost. It's a completely different color from your hands and your neck. So it is something, you know, that a patient has to be counseled about, that you look unusual, and a lot of husbands will be like, you know, especially if it's a patient of color, it feels like I'm married to a white woman. That was one of the comments we got from a husband who came to get the home care. But you know, the peel is not the end of it. So, and after a month, you think this is a great result, but that pigmentation took years and years to develop. So we have to down-regulate that melanocyte to normal function, and that takes months. So this program, using these things, at least 6 months of that. After that, not completely going off, still being really good with your sunscreen. Some people keep on the melan recovery, and then they use a gel concentrate from them with tranexamic acid or other skin brightening, but it's a forever treatment. So we've had really good success. So I'm going to pop some befores and afters in here, but also we've had one treatment failure. So diagnosis is very important, and besides diagnosis is the compliance of the patient. So there's only so much we can do. The most important step here is what the patient does at home, how they're using the products at home. And in terms of diagnosis, so this works well on epidermal hyperpigmentation. So dermal hyperpigmentation, you know, you might have to look at a program called Cosmelan, where we, like, you know, you can't do that as a therapist. It has to be doctor supervised, but or depending on the diagnosis, pico laser. And if there is no success from this treatment, it could be a HORI or birthmark. I often send patients, if I am doubtful before we start treatment, you know, is this going to be something that we'll get success with? Sometimes we send our patients to a derm for biopsy just for proper diagnosis, because you get dermal macules. Not all pigmentation is the same. So the thing with this is, and with melasma, is even after such an intense treatment, you can still get return of the melasma if the triggers are still there: excessive sun use, sun exposure, very hot showers, lots of stress, another pregnancy. So it can return. But things like post-inflammatory hyperpigmentation, where, you know, you get acne and the blemishes from acne, you get quite a great resolution. And a side effect of this is also the extensive collagen production, the pore tightening. It's a very anti-aging treatment. So if you have any questions about Cosmelan, you can drop them in the comments down below. And it's a fantastic treatment. You just have to be emotionally and mentally prepared for it. Thanks, guys. Like, share, and subscribe. Bye.